Hey, Dr. Sachs,
Yes, I'm here.
once we signed up for healthcare justice, do we have to renew that every year or does it just carry over?
No,
We'll never
Okay.
let you
never
go.
let you go. We're like, gorilla glue.
Christian, that's an interesting question because I monitor our membership list and periodically I'll see some names and say, I thought they were already a member. So I think a lot of people may have the notion that you need to kind of re-up every year, but no, once you're on here, unless we see your name in the obituaries, you're with us forever. And even then you might stay on.
Right.
Dr. Sachs, this
Yes.
is Evelyn Maven Hall. I know it's the last minute, but
It's
would
okay.
you please check your schedule for February the 9th and see if maybe you could spend 20 to 30 minutes with the Union County Senior Democrats to go over what you spoke about tonight, to speak with them?
Twist my arm, Evelyn. Hold on. I'm looking at my calendar.
We're a witness to
What
all
ti-
this. So you
what
can't say
time?
no.
Okay, it would be around 1:45.
That'll be great. Glad to do it. Anybody else have anything they'd like to bring up
Thank
or
you.
questions or?
A brief question at the breakout. One of the doctors, Dr. Denise, I think,
Yes.
addressed for a while. I've always thought of the public option as a transition or a stepping stone that might be worth pursuing. I was interested in Dr. Baumfacher. I'm sorry, I don't know everybody.
George.
That's right.
Position on that and why it's not seen as an improved situation for making it more affordable and expanding coverage.
My notion on that, it is that if you could design a public op ideally and somehow have guardrails on it so that the for-profit insurance companies couldn't game it and manipulate it, then it might work. But as I alluded, our fear is that if you had a public option, the private insurers would market their plans to the younger, healthier, and less expensive part of the population. And then that would leave the older, sicker, more expensive patients on the public plan. Its cost would rise so high that pretty soon Congress would say, oh, we're tired of subsidizing that, and it would die. And so we're just afraid that it would be manipulated. And we're afraid to expose ourselves to that. I mean, that's kind of what's happening with Medicare Advantage. It started out 30 years ago as this option, this private option to standard Medicare, that the power of capitalism was going to provide better healthcare outcomes at a lower cost. And neither of those has happened.
I saw the outcomes.
Yeah. But what has happened is the private insurers have made a lot of money on it. So that's our anxiety, our apprehension about a public option. It sounds great. And like I say, a perfect one might be good, but people always have a way of gaming systems.
So let me just add something to totally agreeing with George and tying this into, I think Julie asked this question early about incremental change. As we look at incremental change, things that propose for incremental change, I think that what we need to do, we'll do this as an organization, and I hope we'll get the word out as we think about it and everything, is, does this incremental change really get us closer to Medicare for all, universal healthcare with an even playing field? Or does this incremental change, and a lot of the public option proposals are just like, as George said, they actually sound like they're going to be covering more people, but they actually would move us farther away from that because they would further entrench insurance companies and for-profit and so on. And so Julie's question earlier about what incremental changes do we want, I think you have to look and evaluate each one with that in mind.
Well, can I say something? I think you're right. Look at what happened to Obamacare. It's
Exactly.
just what happened.
They took the public option off the table in order to try to reach a compromise, which
Right. Well, they
they didn't go for it
caved.
anyway. They
just caved.
Yeah, I was when I talked about do we have some incremental achievements as part of strategy. Not that I advocate that, but when I was thinking about public option, I was thinking, I clearly understand Georgie's concern. Yes, that can be, it's not really, helping to get to the universal coverage. But what about the other side of option? For example, if I don't know whether this is legally possible, but government open public option and they allow small businesses go there and let them purchase for their employees through the public option. And then even, I don't know whether the Department of Trade or Business, they can look at kind of promote or encourage the businesses to come to sort of a public option is another insurance option for them so that they can get cheaper admin cost and then they can compare, so make the insurance market more competitive. And that way, business community can be very strong advocate for this public option to save their costs actually. And they don't have to hire, like a ton of employees to provide employee insurance plan. And they just go to public option and then give, okay, we give you 5% admin cost and they will save us money and then come up with a good package. So that can be win-win. And if it can just grow that way, for example, in Japan, government isn't negotiating everything for the employees, the big corporations. So their biggest partner is the National Federation of National Economic Federation. So these are all big corporations belong there. They give the right to negotiate with providers to the government. So Ministry of the Health, once a year, they have a biggest negotiation. They're very tough. And then, they come up with this schedules for every single steps or, products, whatever, and then the whole country just stick to it. So eventually what I was thinking, okay, if we start and if we take the business community as our allies, maybe that's something that we can eventually get there, universal coverage that way. But I'm just.
It also
No, that-
increases the pool of the insured, may perhaps significantly. The pool enlarges of the insured.
Well, I had wondered about that too. Could there be a government option that was so affordable that people would come off of their employer-sponsored plans? But if the one thing I was thinking is, if the healthcare costs didn't come down, how could, and the private insurers, they were charging more for their plans so they can pay for the prices, would you see a lot of medical facilities not wanting to accept the government insurance? Or maybe would it become, you couldn't pay for it if there was still the higher price, the high medical prices, because you can't really negotiate the prices down? I don't know. I was wondering about that too. I think that it's a really interesting question,
Well,
Julie.
isn't it like demand and supply? So if a public option has like a Medicare, like not that size, but if it has a big group, they will have leverage to negotiate.
Yeah, the problem with, let me just say something. A lot of these plans sound good, but the people at our national organization at PNHP who've been working on this for decades, what they say about public options is that, and I think George basically said just this, but that if you have a public option, what usually happens is it becomes attractive to sick people because private insurance maybe is unaffordable for them. The people who are attracted to it are sick people. It becomes more expensive to administer because private insurance has done exactly what they want, which is they've skimmed the well people. You know, that's what they want. They're not there to take care of sick people.
No.
They're there to have well people that don't cost them much so that, you know, so they make profits for their investors. But then what happens, and I think George said exactly this, is then you get sick people, just like on Medicare, you have old people and sick people. It becomes more expensive to run. And then the public says, look, everybody in the government doesn't know how to run anything. Everybody in the public option costs more than in private insurance. And it's just kind of historically that if you do things and you let private insurance in, that they game the system.
Can I ask something? Has anybody approached businesses, small businesses, medium-sized businesses, big businesses, and shown them how their costs will actually go down because they are no longer negotiating in the marketplace for coverage for their companies? Because every year they have to go in and find out how to cover their 50, 100, 1,000 employees. And some of their employees are very sick. Some of them are very healthy, and they're dealing with all kinds of issues. And each year, from what I remember when I was under my employer's healthcare, and from people I know that have it in various companies and including the state government, where you've got them increasing the cost for the individual, and the cost, the employee's expense to have the insurance is going up and up and up, and the coverage that they get is going down, and their deductibles are getting larger. And the thing is, if an employee is paying $200 a month for their insurance, the the business is paying at least $400 or $500 more for that individual. They would be saving a bundle if we had Medicare for all, because they would no longer have to do it. The taxes, I think it's 4.5%, like Social Security is 6 something. The Medicare, it's a tax that you would pay, just like you pay Social Security. The business would pay it and the person would pay it. And that's the end of it. There's no more arguing with the insurance companies, trying to get the coverage they need, these huge deductibles. And so it would all go away. And I think from a business point of view, if I were a business owner, boy, that would be a wonderful blessing as opposed to being a liability as it is now.
Susan, we need to get you out on the speaking tour to talk to executives around the
Yeah.
country.
Happy to go.
Don't forget about portability too.
That is precisely right. And we have in our national group a man who runs a manufacturing company up in Philadelphia. He made a movie, his own money, to produce a movie called Fix It, Healthcare at the Tipping Point. If you've not seen that, good. Okay. Well, he's the man behind that. He's a businessman. And he, with several other businessmen, started 2 or 3 different organizations to go approaching other executives and talk them into this. And it's been so interesting because doesn't it seem obvious? But I heard one thing from a business executive who just retired from a company right here in Charlotte, a Fortune 200 company, billion-dollar multinational company. And I asked him exactly that question. And he said, these guys, the corporate executives, tend to be very conservative. And he said, they view healthcare like a religion. And they don't want the government to have anything to do with it. And it's just it defies economics and common sense. He said, you cannot get them to talk about any improvement because they want to control the health care for their employees, even though it's a pain and even though they do all these negotiations all the time. So there's that kind of mindset that in the corporate world, they just don't fool with. I also thought about approaching CEOs and pointing this out to them. And another response I got, I very serendipitously ran into and had a conversation with the guy who's the CEO of GoFundMe. That was interesting. He didn't know a thing about Medicare for All, so I explained it. And I said, why don't more of your colleagues want to do this? And he said, the deal is that CEOs are so busy running their company that unless something is about to bankrupt them, they just don't want to hear about it. So until employee healthcare costs become a higher priority bottom line issue, they're just happy to kind of let their HR people deal with it or something. So we haven't gotten their attention yet. And exactly what you point out, that the costs are, healthcare costs are inexorably rising. More and more is being shifted onto the employee, with the higher deductibles. And pretty soon that's going to reach a breaking point. We keep hoping that we can do Medicare for All before the breaking point, because the breaking point is going to involve a whole lot of disaster with more bankruptcies and things like that.
Yeah, and I think we're seeing that
exactly
now.
Right. Yeah, well, we're seeing it, but then, especially with the pandemic, with all the people that lost their job related, their employer-sponsored healthcare. So yeah, that's why on the one hand, this may be like same-sex marriage. You go along, not much happening, and all of a sudden, boom, you get a sea change overnight. Maybe we'll have the same thing with the results of the pandemic and all these other preceding things with unaffordable costs, and a realization in the business community that this would be a lot better off. You're exactly right. It makes such eminent sense, but there are these philosophical, deep ideological feelings in a lot of executives that were expressed that, I don't know, it's just crazy.
So Megan had her hand up and then Christian did.
I was just going to say that one of our members, Mick Edwards, does a great job covering the same business benefits of Medicare for All, and he has a small business in Matthews, and spoke at a legislative visit that we had in October with Cynthia Wallace. But talking to the politicians and candidates about it is one thing. I think it would be an interesting idea to talk to other business owners.
We tried.
Businesses and self-employed.
We have.
Yeah, I think the issue is kind of just like George was saying, it's what you're countering is not rational rational decisions. What you're dealing with when you try to deal with business owners and with everyone else, lots of other people, is you're dealing with disinformation. And that, it's like George just said, you're not dealing with like a rational opposition. It's things that people believe, their belief systems and so on. So Christian, did you want to?
Yeah, I was, when I was listening to Dr. Bumfalk, I was realizing it's almost, the CEO is never going to be concerned about healthcare because they're always going to pass an additional cost to the employee. And so it's never going to be an issue for them because it's someone to pass it along to. And so the people, it seems like, to talk to are going to be the HR directors, the benefits people, those people who deal with it every year when they renegotiate it. That's their biggest, the biggest burden, is dealing with it. And, the same reason the unions originally didn't support it was because that was their big negotiating leverage, was healthcare. But right. I was going to say, I'm hoping that, someone talked about like incremental steps until we get to Medicare for All. I'm hoping that our current administration will utilize the Small Businesses Administration to educate small businesses on options in currently the Affordable Care Act, because small businesses can take advantage of the Affordable Care Act if they pay 51% of the employees' health insurance. And I don't think they realize that they can actually get the tax benefit if they pay 51% of that. Many of them just don't want to do it. And so I think we just have to remind people, small businesses have that option now. It's not something that they're left out on, they can actually, their employer can go on to the portal, buy their insurance, and the small business can pay 51% and they'll get that tax rebate back. But many of them just don't want to do it. So it's not like that option's not there. Many of them just don't want to do it. So I'm hoping that the SBA somehow can incentivize them. I don't know how that has to work with the ACA right now, but that option is there. And I don't think a lot of small businesses, especially in like, for an example, the Latin American Chamber, they don't really talk about that kind of stuff. They don't educate people on, hey, these are the opportunities you have right now. It's not like it's there. It's up to you. So I don't know.
Well,
Well-
lest anybody think that we have overlooked these things, for the last 2 or 3 years, we have tried to communicate with HR directors since we haven't been able to get into the corporate suite. And it turns out, I mean, this sounds incredible, but there's a sentiment that HR directors, not Bank of America, but in a lot of smaller companies, 90% of their job is dealing with kind of the health benefits. They're the ones that negotiate all this, work it all out. If we have Medicare for all, they might be out of a job. So there's some HR directors who kind of feel a little bit threatened by the notion of Medicare for all. So they're not supporting it. And so it's kind of hard to determine who to approach about this. Now, some people tell me, go to the CFOs, go to the financial directors of companies, because they're the guys with the eye on the bottom line. But we're still banging on those doors. And if y'all know anybody we could talk to, any big businesses in town, will let us know, because we certainly have the message.
So I imagine we're not going to go on forever tonight, but I want to ask for I have a request for a comment from someone else, which is Carrie. I'm going to call on you. So we have someone on this call who's actually in Canada. So Carrie, do you want to give us a little perspective on this and and what you think about these comments, for instance, about whether businesses would be better off?
Well, in typical Canadian way, I just got a weather warning on my phone about a snowstorm that's coming. And anyway, I'm dumbfounded for 2 reasons. One is how smart you are, how dedicated you all are to bringing about change. The other side to that is I'm absolutely astounded how much more complex the issue is than I originally thought. And I'm pretty reasonably up to date on the American healthcare system. But these ideas about, for example, deductibles, well, Canadians have a hard time when their car has a deductible. When I first heard about deductibles, and I still have family in the States, in Wisconsin and in Hawaii, and I heard about these deductibles, and I thought, well, maybe it's like $200 a year, maybe $400. But people were telling me they're in the thousands. I mean, you can't even pay the damn deductible before you even can enter in and get health care. And that too, I think any reasonable Canadian is just unbelievable. I don't understand that. With respect to businesses, our experience on the community health level was that if businesses thought, now these are smaller businesses, if they thought that they could improve their bottom line, and at the same time, you could convince them that they were providing and being part of an important service to their employees, they usually bought into it. They don't have to have the kinds of negotiations, it seems, in the Canadian system as you do in the American system. I'm really surprised when I hear these comments. I understand how conservative, CEOs might be, and CFOs, and even HR specialists. I understand that there might be sort of an ideological bent, but it also seems to me quite likely that if done the right way, these companies are actually going to save money if they include health promotion, give people money towards memberships and gyms. That's going to actually reduce their bottom line because the usage rate is going to go down. So some of this stuff to me is just, and it's not because I'm really smart, because I'm not, but just on an experiential level, it makes no sense to me that they wouldn't buy into some of these things. I mentioned in our little group before, the Canadian system is very good. It has its serious problems, but this idea of trying to mobilize an entire nation of, what do you have, 350 360 million people to buy into a system that actually would benefit everybody is mind-boggling to me. It is, and it's, you know, I've lived in places where they never thought there could be change, even in healthcare. I lived in Brazil for about 3 years, and even with military governments and dictatorships, and even with an idiot like Bolsonaro, the current president of Brazil. I'm supposed to spit 3 times when I say his name. That's what my grandmother would say. Anyway, you know, there was, again, we go back to the incremental question. When we were working on a community level, and even in Toronto, it was think small, think big, start small. And I know you can't take that model across an entire complex society like the United States. But if you want people to buy in, and this is what I also don't understand, especially in the context of the pandemic, you know, in the United States and in Canada, if ever people wanted to understand what their healthcare is all about and why they're not getting, you know, vaccines, and believe me, in Canada, it's no, you know, great story here by any means. But this is a time you would think, if you're mobilizing people to think broadly about their healthcare and politicians, maybe you're not going to get a time like this again. On one level, let's hope not, because it's a pandemic. But I also will say, in deference, I actually will sleep tonight knowing that this group, I knew about it through Jessica, but really I've never had an opportunity to talk to people, or to, more importantly, listen to people who are actually on the front line, either as physicians or in organizations, not-for-profit organizations, who are trying to bring about change and being really smart about it. So anyway, I'll sleep tonight. Tomorrow I won't. But
Harry, I just have a request for you. Listening to you, I wish we could make a video from the Committee of Communications of you talking about your disbelief of deductibles.
Yeah.
So,
I mean,
if you
it's-
would be willing to have a Zoom call with us and just share your thoughts, that would be
Definitely.
great
Please.
content for us.
well, I'm going to ask Jessica's husband to work with me on this.
Then you're really in trouble, you guys.
Yeah.
I know it's a great idea, but if you get Carrie to do a video, you have to be ready for a few jokes here and there. I just,
I know, that would be
You
great.
know,
I just
that's
want to warn you.
that's the first time Jessica's actually called them jokes. It's usually some kind of groan or some kind of ungodly animal sound I hear from her. Thank you, Jessica.
Well, everybody, this has been great. And we want everybody to sleep tonight, not stay up all night. But all this energy you guys have, anybody who's not already on one of our committees, why don't you please feel free to join a committee and apply some of this energy to it. Everybody's been great.
Yeah, you know, but one of the things that I'd really like to take a look at is all of the answers to the questions, because there were some really good ideas that came out of there.
That would be great if somebody would go over them and like put them together.
Yeah,
Right.
I'll put that on my list.
Can I just say one thing? Dr. Bumfield touched on this earlier. I am very, very optimistic that within my lifetime, we will see Medicare for all. And I believe, and I truly believe it's going to have to be pushed by our millennials. That with them, this is a no-brainer. It's going to have to be pushed politically in the workforce and all these kind of things, just like the Gen Xers pushed marriage equality. You know, for a long time, we were speaking to the choir. It was just talking to gays. In the Gen Xers, there was a strategy to say, we have to talk to suburban white women to let them know that it's not going to impact their marriage. Once that happened, marriage equality came around. And somehow the millennials are going to have to find that, whatever that is. I don't know what it is, but they're the ones I think it's going to happen. I hope it happens in the next 4 years, but you know, I don't know that's going to happen, but
All right,
I'm
it's on your
optimistic.
shoulders.
Christian, thank you, Christian. I've been at this for 45 years, following this debate. And I was thinking big in the mid 70s when I was in public health school, and starting small with managed care solutions and Kaiser Permanente and all the rest. So I appreciate that. I think it is going to be the next generation.
I think I need to, if I'm going to carry the mantle with my fellow millennials, I think I'll need George and Jessica, maybe you can write a history of what you've already done, because a lot of times it's like, oh, I think I have an idea and you guys should do this. And you guys are like, Megan, we've done this.
Thank you all. I have to take off. I appreciate everybody's effort, input.
Thank you.
Great.
Thank you all.
All right.
Thank
Good
you.
night.
Good night.
Thanks.